Okay, good evening everyone. Hope you all are doing good. So today's our class will be about all the important classical sign and symptoms about all the diseases. Okay. So as in the last class we read about all the important triads that were present. I hope it went well for you all. And if you're having any doubts, so let me know. So in today's class we'll be having our clinical what are the important classical symptoms that will straight away give you a hint about the disease conditions and which are very important from your exam point of view, and these are the frequent questions that obviously may come in your exams. Okay, so let's start with it. So as you can see the first image. Okay, so anybody having any idea that what this image depicts? What is this? Means you can see that the mouth is being opened and these spots are being present in the buccal mucosa. So can anybody guess out that what are these signs basically? So these signs are called as Koplik spots. Okay. So these signs are called as Koplik spots. What are Koplik spots? These are basically bluish and whitish spots. Okay, these are bluish color. Can you see these are just slight purplish and whitish color along with some blue remarkable spots which are basically present in the buccal mucosa as you can see in the image. So these are your bluish whitish colored spots which are clearly visible in the buccal mucosa, and these are called as your Koplik spots. And in which disease condition you can find out Koplik spots? Yes, this is a remarkable question. Yes, Koplik spots is basically seen in measles. Okay, it is a classical feature of measles, or you can also call it as rubeola. Okay, so it is a classical sign of measles. Okay, it is also called as rubeola. Okay, so can we know that when these spots appear? These spots basically appear 3 to 4 days before or 1 to 2 days before starting of the rashes. Which rashes? The rashes of the measles. Okay, so onset of Koplik spots seen in measles, that is 1 to 2 days before the appearance of rashes. Okay, am I clear? So yes, so let's quickly summarize that this image depicts it's called as your Koplik spots. These are bluish and purplish colored, basically whitish colored your spots which are generally present in the buccal mucosa as you can see. Yes, and this is a important classical feature of your measles which is also called as rubeola, and your Koplik spots is seen 1 to 2 days before the onset of your rashes. This is important. Okay. So moving on to the next. Yes, can you see this image? Is it visible? Yes. Okay. So what this image depicts? This is, you can see this eyeball is protruded out. Yes. So what it is called as? It is called as, one second, yes, exophthalmos. Yes, this is called as your exophthalmos. Yes. Now the question starts that exophthalmos is seen in. If the question comes to you as an image-based question and if it is asked to you that this condition is seen in which disease condition or in which situations, yes? So what you can say? It is seen in Graves' disease. Yes, exophthalmos is seen in Graves' disease. What is Graves' disease? Graves' disease is a feature of primary hyperthyroidism. It is a feature of primary hyperthyroidism. Yes. Okay. So what happens in primary hyperthyroidism? So just quickly get us a review. Yes. it is basically, the exophthalmos, it is seen in grave stages. It is an autoimmune disorder in which the body pushes out the tissues behind the eye to protrude out. Yes, that's why the swelling is like this, looking out. Yes, so in primary hyperthyroidism, in primary hyperthyroidism, the thyroid glands are overactive, in which we can see the T3 and T4 hormones are increased. Yes, while your TSH, okay, that is a thyroid stimulating hormone, is found decreased. So this is a feature of your primary hyperthyroidism. In this, the T3, that is your thyroxine, yes, T3, T4 hormones, these are increased in primary hyperthyroidism, while the TSH hormone is reduced. Okay, so this is called as primary hyperthyroidism, and grave stages is a feature of this, in which we can see this exophthalmos that is protruding off your eyeball. Okay, and grave stages is an autoimmune disease condition. This much is important for you all to know. Okay. Yes, am I clear? Okay. So, moving on to the next image. Yes, can you see this? Can you find out something unusual in this image? Yes, this is basically, this protrusion or this swelling is somewhat looking like an olive. Yes, so this is called as your olive shaped mass in the abdomen. Yes, okay. So the question comes that olive shaped mass in the abdomen, it is seen in basically infants and children. So in which condition it is seen? So the answer is, it is seen in hypertrophic pyloric stenosis. Okay. So the answer is within this line only. Pyloric stenosis means the lower end of the stomach, that's the pylorus, this gets thickened in this condition. So due to which the food substances is not allowed to move beyond the stomach. So the food does not enter to the small intestine, which leads to vomiting of the child. Since the food is not being passed to small intestine, so it's not being able to get digested and absorbed properly. That's why the food is again regurgitated back to the it's again regurgitated back, and it leads to the vomiting. It is which basically seen in the child. So which kind of vomiting is seen in your pyloric stenosis? That is a non-bilous projectile vomiting. Okay, so you need to remember this line, non-bilous projectile vomiting. It is seen in pyloric stenosis. Okay, and olive shaped mass is also seen in hypertrophic pyloric stenosis. And if the question comes to you that when you can see the hypertrophic pyloric stenosis, it basically appears from 3 to 4 weeks of life. Okay, in that period it can be seen. Yes. Okay, and the nature of the vomiting is non-bilous projectile vomiting. Clear? Okay. So next, moving on to this is two important things, Brudinski sign and Kernig sign. Okay, this you don't need to. Okay, so what is Brudinski sign and what is Kernig sign? We'll be seeing this. Okay, so as you can see in the Brudinski sign test, okay, the doctor or someone is trying to lift up the neck of the or head of the patient. Okay, as you can see here, it is someone is trying to flex or someone is passively trying to lift up the head or neck of the patient. As we are doing it, the lower extremity, the left lower extremity, that is a leg, that is automatically it is getting flexed upwards. Okay, so if this happens, it can be this test, if found positive, indicates what it indicates, where it can be seen. It is seen in meningitis. Okay, am I clear? Yes. So positive Brudinski sign helps you to indicate about, it may indicate about presence of your meningitis. Okay. Yes. So the next test also the same, that is Kernig sign. What happens in Kernig sign? The patient is lie flat. Okay. and the patient is made to lie flat in a supine position. And when the doctor or the person who is trying to test or trying to do the test, when he passively extends out or straightens the knee of the patient, automatically patient will feel pain at the lower back or at the hips. If the patient feels the pain, it indicates that the test is positive, and a positive Scarnick's test indicates about again meningitis. Okay, am I clear? So this indicates that, so when the person passively straightens or extends the knee of the patient, automatically the patient will feel that pain at the sharp pain in the lower back or in the hips. So it will indicate that the test is positive, which is again called as a positive Scarnick test, and it gives you a clear indication about the meningitis. Okay? Yes? Okay. So this is our again another image. Can you see something unusual in this image? In this image we can see the lower eye bags. The eye bags of this lady is swollen. Yes? It is called as, it is called as periorbital. This is called as, okay, periorbital edema. Okay, this is called as periorbital edema. And if we are seeing periorbital edema with proteinuria, so these two are a classical feature of nephrotic syndrome. Okay, so the presence of periorbital edema, okay, generalized edema, swollen of the feet, along with proteinuria, massive proteinuria, that too massive proteinuria, if you are seeing this, that means the patient is having nephrotic syndrome, because the presence of your periorbital edema, generalized edema, massive proteinuria and hypoalbuminemia is basically seen in nephrotic syndrome. Yes. So this means massive proteinuria will be seen, okay, and as well as hypoalbuminemia. You know, this edema is also due to the reduced albumin content in the body. Because what does albumin does? One second, okay. What does albumin does? It is the function of albumin to draw out fluid from the cells and tissues into the blood. This basically acts as a sponge. Okay. And if albumin is reduced, so definitely it won't be able to absorb all the fluids from the cells and tissues into the blood. Okay, that means the fluid will be pushed out from the blood into the tissues. So tissue level fluid, the fluid in the tissues and the cells will increase, leading to edema. Okay, so this is the mechanism behind this periorbital edema, as we can see. Okay, so it will lead to edema around your periorbital edema. It will lead to swelling of your hands, lower extremities, yes, swollen feet, generalized edema, and proteinuria. So these are all the clinical symptoms and important features of your nephrotic syndromes. Okay, so hope the class was useful for you all, and if you're having any doubts, so let me know. Okay, thank you and have a good day.